Diane had been on Luvox for 3 weeks when I first saw her. The medication meant to quiet her racing mind was actually making her feel worse. She was sure the drug had failed her. She was sure something was wrong with her specifically. But she was wrong on both counts. What was actually happening to Diane is something almost no one explains about this drug, not even many of the doctors who prescribe it. I'm going to show you 3 of those things today. One of them is probably sitting in your kitchen right now. And if you take Luvox, now sold as Fluvoxamine, understanding them could change how this medication works for you. But before any of the science, here's what you need to know first. If you've taken this medication and felt worse, or felt nothing at all, and somewhere along the way quietly decided you must be broken, you're not. That chest tightness, the racing thoughts, the social anxiety, the OCD symptoms, none of that means your nervous system is broken. It means it's doing exactly what an overloaded nervous system was built to do. I'm Dr. Air, quadruple board certified psychiatrist. So what is Luvox? Now, people assume it's a general anxiety pill like Zoloft or Lexapro. It isn't exactly, even though they're all SSRIs. Fluvoxamine was made first and foremost for obsessive compulsive disorder. The strongest evidence backs it for OCD and social anxiety. Now, one more thing about this drug's past. I'm sure you've heard of Prozac, the more popular SSRI. But Fluvoxamine got on the market first. It launched in Switzerland in 1983. Prozac didn't reach the United States until 1987, about 4 years later. This next part is where Diane's story finally starts to make sense. Your liver clears most medications using a set of enzymes. One is called cytochrome 1A2, and it's the main enzyme your body uses to break down caffeine. Fluvoxamine happens to be one of the most powerful blockers of cytochrome 1A2. In a controlled study, caffeine's half-life on fluvoxamine stretched from about 5 hours to about 56 hours. 56. What this means is that a single cup of coffee can linger in your system for more than a full day, and then tomorrow's coffee gets added on. This means that 1 cup of coffee very quickly begins to feel like 5. Coffee, being a stimulant, worsens the racing heart. The wired but tired feeling, the sleep problems, the excessive worrying. Those aren't always the anxiety your medication failed to fix. Sometimes they're caffeine quietly stacking to levels your body can no longer clear. That was Diane. 3 cups a day, same as the last 20 years. The drug wasn't failing her. Her coffee was aggravating her anxiety as it was accumulating in her system with Luvox. So we didn't change the dose of her medication. We decreased her caffeine intake, and within a week, she was doing much better. So if you take Fluvoxamine, you need to let your prescriber know about your caffeine intake. Coffee, tea, energy drinks, even chocolate. You may not need a different medication, and this is the piece almost no one tells anxious patients. Fluvoxamine is strange among the SSRIs. When researchers lined them up side by side, fluvoxamine showed the highest activity at the sigma-1 receptor, higher than Prozac, Zoloft, and the other SSRIs. And activity at the sigma-1 receptor does something very important. It calms inflammation. Why does inflammation matter in this video about anxiety? Because this is the part the old chemical imbalance story left out. Anxiety isn't only about serotonin. Your nervous and immune systems constantly talk to each other. When your body is inflamed, it also affects your brain, making it lean more toward threat mode and quicker to sound the alarm. We call it neuroinflammation, and it's one reason anxiety so often deepens in midlife, when inflammation tends to slowly worsen. That sigma-1 effect is exactly why during the pandemic, this old anxiety drug suddenly showed up in COVID research. An early 2020 study looked striking. People with COVID-19 who were given fluvoxamine seemed far less likely to get worse. As you would expect, the internet lit up at the time. But when bigger, more careful trials followed, that dramatic benefit didn't hold up. Another thing to note is its effectiveness for treating social anxiety and OCD. When researchers ranked 21 antidepressants in one of the largest reviews ever published in The Lancet, fluvoxamine was found to be effective but was placed in the bottom tier for both efficacy and acceptability. This made it a less favorable option according to the researchers. This could explain why fluvoxamine is rarely any mental health provider's first choice for patients. But here's the thing. Some of you may have found this medication very helpful, while others may have had a negative experience with the same drug. Both can be true because the same medication can have completely different effects in two different nervous systems. I prescribe fluvoxamine. I'm not against it. What I'm against is handing anyone a pill without the rest of the picture. Diane's medication, by the way, had been doing its job the whole time. It just couldn't outrun 3 cups of coffee and a nervous system no one had ever thought to settle. And that's the lesson, bigger than any single pill. A medication is one lever. It is not the only one. Your nervous system is also affected by several other processes. Inflammation, blood sugar that swings too hard between meals, a vagus nerve that needs to be reset, and sleep, the hours when your brain does its actual repair. If you leave those untouched, even the right medication won't help. Diane didn't need a stronger drug. In addition to regulating her coffee intake, we worked on optimizing her nervous system using my reset method. If you want the full approach, the link is in the description below. Fluvoxamine as an antidepressant was ranked in the lower tier by researchers. If you want to know more about another antidepressant that was ranked higher for anxiety, then watch this next video.